Welcome to the Spirit of Women event tonight at Aspirus Riverview. It is Check Your Neck, and the emphasis is on thyroid disease. My name is Liz McCodlow. I'm the Director of Food and Nutrition Services and a registered dietitian here at Aspirus Riverview. There is no such thing as a thyroid-specific diet. So tonight our refreshments are going to reflect those nutrients that are important for thyroid disease. Some of these nutrients include selenium, magnesium, iodine, copper, and the B vitamins. The appetizer tonight is sunflower cheese balls. This is a mixture of Munster cheese and cream cheese rolled in sunflower seeds. Sunflower seeds are an important source of selenium, and this recipe also provides some needed copper in the diet, which will help keep our thyroid healthy. The main thing you want to do is eat a good variety of foods. You want to eat foods with colors of the rainbow. Our beef canopies with a cucumber sauce are a colorful appetizer that provides an important source of iodine and iron in the lean meat. The lean meat, beef, should be sliced thin, be a tender cut, and you can get the needed B vitamins by using a whole grain bread or a whole grain baguette. Our main entree tonight is Italian shrimp and pasta. Shrimp is a source of iodine. This mixture also has tomatoes and chicken. The chicken is going to provide needed iron, and the pasta product is going to provide the B vitamins, which also are important for healthy thyroid. Use a whole grain pasta, use small shrimp, cook it, and not deep frying it, and you'll get the healthy ingredients you need. Then, every woman likes chocolate. I don't think there's a woman alive who doesn't like a good, deep, dark chocolate. This chocolate nut bark was homemade. It includes almonds. Almonds are a good source of magnesium. You can enjoy a dessert like this and include it in a healthy diet. The beverage tonight is lemon water. We hope you enjoy the program. Thank you.
It's 5:32, so I think we'll go ahead and get started. Welcome everybody to our newest Spirit event called Check Your Neck, and I wanted to offer you some exciting news. Spirit of Women is going to go all through the Aspirus system now. So every Aspirus hospital is going to have a Spirit of Women program, which is very exciting. And we're even going to offer Spirit of Women programming in Point. You can't hear me? That never happens. So sorry. Thanks for letting me know. And so Spirit of Women is going to be rebranded with a new name called Aspiring Women. And so all you ladies who are Spirit members will now be Aspiring Women members. And that's what we try to do. We try to aspire you to and engage you to take charge of your own health and wellness through our educational and actually very fun programs. I hope you think that they're fun. So this is the new logo that you will see when you get your e-blast and your postcards. Don't think it's just junk mail. Realize that you are now Aspiring Women. So tonight, I am very excited to introduce these two lovely young ladies up here. And of course, I have to share a little bit of information about them. So this is Lindsay Reimer, and this is Caitlin Parmeter. And really, I should go this way, Caitlin and Lindsay, because that's the order I was going to do it. Thank you very much. Both these ladies were born and raised in Wisconsin Rapids. Both of them attended Assumption and graduated from Assumption. I don't know if it was the same year.
1 year apart.
1 year apart.
Yeah.
You know, I
1 year
tried to
older.
calculate that, and I thought that maybe that was. So Caitlin left Assumption, and she went to UW Eau Claire. Well, Lindsay left Assumption, and she went to Marquette. Then Caitlin went to to get her master's in physician assistant studies from Du Bois University, while Lindsay received her master's in physician assistant studies from Marquette. Caitlin worked as a PA in Minnesota for 2 years. Lindsay spent a month in Belize on an international medical rotation. Caitlin married a man from Rapids, so guess what Lindsay did? She also married a man from Rapids. Caitlin has a baby boy. What do you think Lindsay has? Yes, she has a baby boy. And guess what? Caitlin enjoys long walks and hiking, where Lindsay is a little different. She's a long distance runner. So they are both physician assistants for Aspirus over at the doctor's clinic. And one more piece of information, or two more. Lindsay is a former Miss Wisconsin Rapids, so you might recognize her from that. And Caitlin wrote on her bio to me that she met her husband in kindergarten. And in the same sentence she said, we got married, and I thought it said at 3.5.
No.
But then I read it again, and it said 3.5 years ago. So please welcome Caitlin and Lindsay.
There you go. All right, so as Nan nicely introduced us, I am Lindsay and this is Caitlin, and we're here to talk about thyroids today. Can you hear me now? Better? Thanks. All right, I'm going to first start off talking about what a physician assistant is. Does anyone in here, or is everyone pretty familiar with physician assistants? Or good. Well, I'm just going to give you a little review before we start. So we are a mid-level provider, meaning that we don't claim to be a doctor. We went through medical school and we did an internship. We didn't do a residency, so that's kind of the main difference in education. I spent 5 years in school total. I think Caitlin was maybe six years. Yep. The graduate program is usually a 5 to 6 year total schooling, and we're very similar to doctors in that we examine patients, we order tests, we prescribe medication, we PAs can be seen in the hospital setting or in a surgical setting. Both of us do not do that, but they are seen in a lot of different types of medical specialties. And we practice very independently. We each have a supervising doctor who supervises us and oversees what we do, but you would never see our doctor looking over our shoulder while we're seeing you in the clinic or in the hospital. We practice very independently, and when I was in school, we were taught to say that we get our independence from our dependence. So if that makes any sense. Just kind of a general overview of what we do. And anything you want to add to that, Caitlin? Or?
So we're never going to become real doctors. This is just what we do, and we can be like your primary care provider. You don't have to have a doctor listed. So when the ER asks you like who's your doctor, you can say a PA. There's not a rule about having to be an actual doctor.
Mm-hmm. And you don't have to call us doctor, like Caitlin said. It happens actually on a daily basis. We just nicely correct everyone who says that.
You can just call us Lindsay and Caitlin.
Yep, it's a compliment, but we didn't really earn it, so you don't need to call us that.
Yeah.
All right. And just to give you a little overview of what we're going to talk about today. First, we're going to talk about the anatomy. So, where is the thyroid? What does it do? We're also going to talk about the different laboratory tests that we use to test and see the function of the thyroid. We'll also talk about a few different types of thyroid disease. So some autoimmune problems we'll talk about. If you're making too much thyroid, if you're making not enough thyroid hormone. And then we'll also talk a little bit about thyroid nodules and then thyroid cancer. So just to give you a little overview.
All right. Supposedly this has a pointer on it. Can anybody see the little red dot? Okay. So all this pink stuff in here is your thyroid gland. There's two lobes to it, one on either side of your windpipe. And on top of that, there are two tiny little parathyroid glands. and this next picture will show a little better. People say it looks like a butterfly. I never really understood that, but so I guess a wing and a wing. So you can see if your thyroid gland was getting enlarged, how it may cause trouble with breathing, swallowing, because it does sit right over your trachea or windpipe. So right beneath your Adam's apple, if you all want to check your neck right now, you shouldn't really be able to feel your thyroid. If you can feel your thyroid, that means it could be enlarged. So physiology was my least favorite subject in school, so we're going to keep this very brief, I promise. So the way the thyroid works is it takes iodine from your bloodstream, and it uses that as kind of fuel to make the hormones that go out throughout your body and work on the different processes in your body. So your thyroid's kind of in charge of telling your body how quickly to do things, so it's kind of like the control center or powerhouse of the whole body. But your thyroid doesn't act alone when it does this. So your brain, specifically the pituitary and hypothalamus, tell your thyroid to make hormone or not to make hormone. And it does that using the TSH, or thyroid stimulating hormone. So your brain has senses how much hormone is in your body, and it'll, am I not loud enough?
Just keep dancing.
Okay. Oh. So if your brain is sensing that you don't have enough hormone in your body, it's going to release a lot of this TSH, or thyroid stimulating hormone, so that your thyroid produces more of T4 and T3, which are the hormones. If your body has too much of this hormone, your brain is not going to send out that TSH, so it's not going to tell your thyroid to do anything, and your thyroid would hopefully just not produce anything until things even out again. Does that make sense? Kind of. Okay. So when you go to your doctor and they're going to check your thyroid, the test names can be a little bit confusing. So TSH is that thyroid stimulating hormone. So that's that hormone that goes from the brain to the thyroid and tells your thyroid to work. So if your TSH is elevated, it actually means your thyroid's probably not working as well as it should. This is the part that gets confusing. I call patients and I say, oh, your TSH was really high, you know, we're gonna need to put you on some medication, your thyroid's not working. And people are usually like, isn't higher good? You know, higher the better, but not in this case. Free T4 and free T3 are the amount of hormone that's actually free in your blood to work on those body processes. So these are the ones that, if your thyroid's working really well, will be elevated. And they're short for this word and that word, which you don't have to understand or worry about, okay? And then TPO antibodies are elevated if you have like an autoimmune response going on, and that causes a lot of different thyroid problems. So if your labs come back abnormal, we might run a TPO antibody to give us an idea of why your thyroid isn't working like it should. Alrighty. So the big hitter, hypothyroidism. Hypothyroidism is when your thyroid is not producing enough hormone. So we have a lack of thyroid hormone out running around in our blood system. And lab work would show an elevated TSH like we talked about, and then a low T3 and T4. These are some of the famous ladies with hypothyroidism. She's got a new movie coming out, and then everybody knows Oprah. So hypothyroidism affects about 7 to 11% of the US population. So 25 million people roughly are diagnosed right now, and then we think there's another about 12 million people who are currently undiagnosed. This could be, you know, they just aren't going into the doctor. We get told all the time, I'm only here because so-and-so dragged me in, or I'm afraid of the doctor, so maybe you're hiding from us. Or it could be that you didn't realize your symptoms were anything more than, you know, I'm a mom of 5, of course I'm tired. So either people aren't coming in, or they just didn't realize to tell their doctor that they're having certain symptoms, or sometimes you come in and your blood work is normal because your thyroid is just starting to not work as well. So maybe we hit you in the middle where your labs are still normal, but you're on your way out. So maybe in 6 months, if you had it rechecked, your levels might be below normal now. And then we're going to talk more about these kind of symptoms later, but these are some of the visual things that you can notice. Thinning hair, thinning eyebrows, swelling under the eyes, and just kind of puffiness or edema of the face. So symptom-wise, there's a cute little acronym, sluggish, which is how you feel when you're hypothyroid. Cute little slug. So the first S is sleepiness or fatigue. This isn't, this is like, I'm getting a good night's sleep, I'm not tossing and turning, why am I waking up tired? Obviously if you're snoring all night or you're only sleeping 5 or 6 hours, you're gonna be tired and it's probably not your thyroid. But this is for the people who are out there getting their 7 or 8 hours and they just can't get going. Next one, L, loss of memory, poor concentration. This also is not for the person who's juggling like 10 different things. This is, I'm not really stressed right now. I don't have that much going on. Why do I have to use sticky notes everywhere? Why can't I remember things? I'll admit I forgot a patient in the room the other day. Stuff happens if you have a lot going on. Yeah, stuff can happen. It doesn't mean I have a thyroid problem, but maybe if this is a continuing problem, think about it. I promise if you come see me, I'll try not to forget about you. Unusually dry skin. So this is, we all live in Wisconsin and it's the winter. Everybody has dry skin. But this is, I'm using lotion twice a day. My skin's just peeling off. Help me. Goiter, which is a swelling of that thyroid gland. You will note, usually it's visibly obvious to somebody that you have the swelling underneath your Adam's apple. You might notice trouble swallowing, feeling like a pressure in your neck, maybe even trouble breathing. And then gradual personality change or depression. So you're not interested in your normal activities. You'd rather stay at home in bed all day. You don't want to go out and meet your ladies for coffee or whatever you like to do. And then this is the one that freaks everybody out, increased weight. So this would be, I'm eating the same foods, I'm exercising like I normally would, I just keep putting on weight. Obviously it could be stress or hormones or a whole host of things, but it could be thyroid hormone in particular. And then sensitivity to cold. So this is, everybody else has shorts and t-shirts on, I have 3 layers, why can't I stay warm? I'm always cold. And then hair loss. It's perfectly normal to lose about 100 strands a day, which nobody believes me, but it is. But this is, I'm clogging the shower drain, my comb is just full of things, my part's, 2 inches wide now, those kind of hair loss changes. So this is more how the thyroid actually affects the body. So when your hormone levels are too low, we mentioned the depression, decreased concentration, lack of interest. But your heart actually doesn't beat as hard or as fast as it should. So that kind of gives you the why you feel so sluggish, why you feel so cold. Kidneys start to not function as well, so that's why we retain that fluid and can have the swelling of our face and under our eyes. It can cause some reproductive problems, decrease your risk of becoming pregnant. Decrease your odds of becoming pregnant. And then it can cause your periods to jump all over the place. Maybe they're happening 2 weeks apart or 8 weeks apart instead of their typical. And then we always check thyroid levels very closely when a woman is pregnant. Having normal thyroid levels in the mom is very important for that developing infant. And then stomach-wise, it can kind of back you up, slow things down, it's a little bit of constipation, stomach upset. And then lastly, your cholesterol. It can increase that LDL or bad cholesterol and increase your triglycerides. So this is, you go in for your annual exam and your doctor's like, oh, your cholesterol sucks this year. And you're like, well, I'm eating the same foods. I don't really understand why. It could be genetics, so you could blame mom and dad. It could be a lot of things, but it could be your thyroid as well. So hyperthyroidism can be confused with act like menopause. As you can see here, they do share a lot of the same symptoms. Also depression, diabetes, really a whole list of medical problems. So when you come in and you're convinced it's your thyroid, try to be open-minded to some other things you might want to check and rule out first. So just keep that in mind. A lot of ladies come in really hoping it's going to be their thyroid, and sometimes it is, but a lot of times it's not. But there's other things we can check for and rule out. So now that we know that your thyroid's not working properly, how do we fix it? And the way we do that is to give you artificial thyroid hormone. We just replace what your body's not making. And this is easy. It just comes in a little pill that you take once a day in the morning with some food. The tricky part is getting you on the right dose. So the way that we do that is kind of based on your weight and based on how off your thyroid markers are. We kind of take our best guess, for lack of a better system, and start you on a medication. We then check you back in 6 to 8 weeks to see if your levels have improved, have they gotten back to completely normal, and we kind of titrate you from there, having you come back in for blood work as needed. Once you're on a steady dose, most people can stay on that dose for their lifetime. Other people, every year they're still off. Foods can affect how you absorb the artificial thyroid. People with that have like a daily coffee habit usually need about like 25% more of the artificial hormone than everybody else does. So that's something, if they kick their coffee habit and then all of a sudden they're coming in and their labs aren't right, that could be why. We wanted to mention this Armour thyroid, which is very, very popular in like the kind of homeopathic community. It's considered more natural because it's actually pig hormone, but insurances hate to cover it. It's more expensive and really doesn't work any differently than the artificial. So if you read something saying you absolutely need that, probably not worth your money. Levothyroxine and Synthroid are the two most common medications that are prescribed. And so now that we know what it is and how to treat it, what causes hypothyroidism? The most common cause is Hashimoto's thyroiditis, and Lindsay's gonna take that for me. But other causes are surgery. If you had to have like a nodule or something removed near your neck and your thyroid was damaged or part of your thyroid was removed, then obviously that part that's left might not function as well as the whole thyroid. So that could be one reason. Certain medications, lithium, which is a common like mood stabilizer, some of the steroids that we give you if you're having like arthritis pains or an asthma attack can lower the amount of thyroid you produce. Certain street drugs can, but hopefully we don't have to worry about that in here. Congenital defects, so maybe you're just born with a thyroid that doesn't function quite properly. Pituitary problems, because that's the part of the brain that tells the thyroid what to do. So if your pituitary isn't working properly, it's not going to be able to tell your thyroid what to do, and your thyroid therefore won't function properly. And then I mentioned kind of the nodules and growths. Even if you don't have them removed, sometimes just them being there can suppress your thyroid's function because it's either pressing on your thyroid or irritating your thyroid in some way. So now we'll hand it over to Lindsay.
All right. So Hashimoto's thyroiditis, kind of a fun thing to say. So this is a really big cause of hypothyroidism, as Caitlin said. So this is where the autoimmune or the genetic component of thyroid disease kind of comes into play. So this is an abnormality that we'll see those TPO or those thyroid antibodies will be elevated, even though sometimes the TSH or T4 may not be abnormal, but the antibodies will be very highly elevated. We tend to see it more so in middle-aged women, like this lovely gal here, Kim Cattrall. She has Hashimoto's thyroiditis. I mean, definitely not a exclusive group, but we tend to see that in those types of women, or excuse me, in that age group. And we definitely see it after pregnancy. So I just had a baby 6 months ago, and a lot of the symptoms of just postpartum or just having a baby really tend to mimic Hashimoto's thyroiditis or just hypothyroidism. So you have the hair loss, you have weight changes, you can have bowel changes, skin changes. So a lot of times it might not be a bad idea to have your thyroid checked if these symptoms are really severe or if they're sticking around longer than we would think they would be. So just something to kind of keep an eye on and think about. We usually see hypothyroidism on our lab results, so that's a high TSH and a low T4, but sometimes it can be started, or it can begin as a hyperthyroidism, which is the opposite, so a low TSH and a high T4. And a lot of times just throughout the course of thyroid disease, we're always kind of battling hypo, like it's just kind of always changing, so we're always have to keep an eye on that. The same treatment is indicated, so the levothyroxine, usually if we can get to the right dose and titrate it, that should really help that. But treatment is not necessarily indicated as long as the lab levels are normal. And I believe that's about all I had to say. But when I was Googling pictures for this, there's quite a lot of celebrities who have this, which is kind of interesting. I don't know, I'm always interested when more about celebrities' personal lives, such as kind of stuff. Just something I like to look at once in a while. Like I love reading People magazine, so a lot of celebrities have this. So good to know. All right, I'll pass it over to Caitlin again.
All right. So hyperthyroidism. So this is the one people get excited about, but we're going to talk about maybe it's not all it's cracked up to be. So this is when your thyroid is working too well. You have an overproduction of that thyroid hormone. And so lab-wise, you're going to see an elevated amount of the hormone in your blood. So that T3 and T4 are going to be high. And then the thyroid stimulating hormone is going to be low because your brain's not telling your thyroid to do this. It's just doing it on its own. It's kind of gone rogue. And so usually that thyroid level will be very low, like lower than 0.6. Good old Barbara Bush and Jillian Michaels are some of the famous people that have had hyperthyroidism. And some of the visual symptoms, again, are that goiter. So you can have the goiter in hyper or hypo, which is a little bit confusing. And then bulging eyes. Lindsay's going to talk more about that later, so I won't steal her thunder. But those are some of the and I also have a terrible time pronouncing the name, so she'll talk about that. And so hypothyroidism affects about 1% of the US population, which you guys might think, okay, I can not pay attention to this 1% is nothing. But who here knows somebody with red hair and blue eyes? Okay, seriously, this is it? Okay, a couple other hands back there and over there, perfect. You guys are like really not working with me here. So this is my little redhead with blue eyes. And so the odds of having red hair and blue eyes is also about 1% of the population. So every time you see an adorable redhead, you think in your head, I have the same odds of seeing somebody with hyperthyroidism. You know, obviously you're not going to probably tell by looking at them as much as the big red hair. But so same odds. And I had to sneak in a picture of my kid. So.
Of course.
So hypothyroidism, the symptoms and how it affects the body are pretty much the opposite of hypothyroidism. So it's kind of like you drink too much caffeine or you're talking in front of a bunch of people. Nervousness, sweating, difficulty sleeping, you just kind of feel wired. The bulging eyes that we talked about, the goiter that we talked about, period changes again, so that happened in hypo, and it also can cause troubles with infertility and increase your risk of miscarriage as well. The moist palms kind of goes along with being sweaty, increase the bowel movement, so you might be running to the bathroom more often than you'd expect. When you are pregnant, you might be more miserable, excessive vomiting in pregnancy. And then the goiter can cause some changes as far as like a hoarse voice, trouble with swallowing, trouble with breathing, and then rapid heart rate versus the low cardiac output, and then I mentioned all of these. So pretty much hypo is everything kind of low, slows down. Hyper, everything's wired, everything is going hyper, okay?
So Caitlin, do you think we have some of these symptoms right now?
Exactly, a little bit, hand for sure. And then hyperthyroidism can be confused with act like anxiety. I mean, you have somebody come in saying like, my heart's always racing, I get so sweaty, I just can't sleep at night. I mean, that could very well be your thyroid, or it could be very well that you're anxious, or you have a speech to do in front of 130 ladies. Caffeine overuse, you know, so this is, you stepped up your game, you're drinking 4 Red Bulls a day and your normal pot of coffee, you could feel the exact same way, and yes, people really do that. Eating disorders as far as some of the bowel changes, the weight loss, things like that, and then, not to be scary, but some cancers can result in the same kind of weight loss, sweats, especially at night, that sort of thing. So how do we treat this? It's not quite as easy. There's just no one pill a day. Oftentimes we'll send somebody to the endocrinologist to do these treatments. Most primary care doctors wouldn't do these in their office. The first treatment is radioactive iodine therapy. So this is where we actually kind of nuke your thyroid in hopes that it's not going to work as well as it had been. And then kind of the most drastic way is with a thyroidectomy, which is a removal of your thyroid, either partial or all of your thyroid. And usually after these two, we do need to replace that hormone. So now you're going to be hypothyroid. So we took you from too high, we nuked your thyroid, we took your thyroid out, so now you're going to be too low. So you're going to be on that daily replacement medication. And then there are some other oral medications to stop the thyroid from working as well. These aren't used as commonly, and then sometimes after these you will need to have the artificial hormone replacement, not always. But those are options as well. But like I said, usually that's handled by an endocrinologist. So commonly caused by Graves' disease, which Lindsay's going to hit again. And then other causes are tumor, multinodular goiter, so kind of the same idea. Your thyroid's getting too big, so it's just working too well. It's just working kind of over time. It's just too big for the job. And then thyroiditis. But then, as Lindsay mentioned, thyroiditis, usually you start out hyper because your thyroid gets inflamed and it's working really well, and then it kind of burns out. So then eventually you'll turn into a low thyroid. All right, there's your clicker.
Thank you. All right, so Graves' disease. I kind of like to think of this, like you feel like you kind of want to be in a grave. So, Graves' disease. So this is when your thyroid just goes really hyper and you feel hyper. But this is that autoimmune component as well. We tend to see this in younger women, so usually under age 40, as this lovely Kelly Osborne we have here. I kind of make hyperthyroidism look kind of nice, but most people don't look that nice when they have hyperthyroidism. And we're going to talk about the bulging eyes, or exophthalmos. It's kind of a fun word to say.
She does a really good job with it.
Medical words are fun to say. So this is the exophthalmos. It's actually kind of scary looking. When I was making this PowerPoint, I was doing some changes kind of in the wee hours of the night, and I was Googling exophthalmos or hyperthyroidism, and I definitely got scared. They look like pictures from like a horror film. They're very scary. But it is really a very common symptom, and it's not someone who's just really has big eyes. I mean, that's just how their eyes are. It's not just the wide eyes, but it can be puffy eyelids, it can be red eyes, there can be double vision, vision loss, a lot of sensitivity to light. When you think when your eyes are open that much, you're going to be a lot more sensitive to external surroundings, and obviously pain too, and you're probably more apt to get things in your eye, and so definitely not a good thing. Usually this is remedied obviously by treating the thyroid disease, but there can also be surgeries done to correct the eyelids. All right, so we're going to also talk about thyroid nodules. So a nodule can be fluid or solid. We usually see that most of these nodules are benign or not serious. So it's similar to when you get a mammogram, you get a call back saying that you need to have, like an ultrasound done, or you need to have some views repeated. In most cases, or the majority of cases, you don't have breast cancer. It's usually just a dense fibrocyst, or just a dense cyst of tissue that is not serious, and we just kind of need to monitor it. So it's kind of similar to thyroid nodules. Most of the time we do not have signs and symptoms of them as long as they're not serious. But if you do have symptoms, you might get like a palpable mass on your neck. You'll be able to see it, so there'll be actually enlargement. You can get those hyperthyroid symptoms that we mentioned before. You can feel short of breath. You can also have problems swallowing. Anything that would have to do with that neck region you would feel. Causes of thyroid nodules. Thankfully in this country we have a lot of iodine, and we have that in our salts, and there's plenty of salt in the US, so we have tons of sodium. So usually that's not a problem here, but in third world countries it definitely is. We can see just an overgrowth of thyroid tissue, and that's just from causes we don't necessarily know about, but it can just overgrow for other reasons. There can be a thyroid cyst. There's different types of cysts that grow within the thyroid. Most of these are not serious. Just chronic inflammation, so maybe you've had thyroid disease for a long time and it hasn't been treated, or you're not aware of it, and things can develop when those thyroid levels are off for a long amount of time. And then thyroid cancer, which we're going to talk about in just a minute here. And Caitlin did mention that multinodular goiter. So really, as the name says, there's multiple nodules within that enlarged thyroid. It doesn't necessarily mean there's more serious disease present. It just means there's more nodules present. All right, so how do we diagnose a thyroid nodule? So when you go to your doctor's office, they will obviously examine you and watch how you swallow and palpate the area. As we have talked about a lot here, the thyroid function tests, the TSH, T4, T3, those types of things. We usually will do an ultrasound next to see if the nodule is fluid or solid. Then we can also do a biopsy during the ultrasound to see what type of components it's made of. And then after that, if needed, there's a thyroid scan. That's kind of a radioactive scan that we can evaluate the nodule further. How do we treat thyroid nodules? Well, it really depends on the kind of nodule and how many you have and the type. But a lot of times we just kind of watch it. It doesn't necessarily always have to be removed right away or treated right away. We can just kind of monitor it maybe after a few months, maybe even a few weeks, depending on the severity. We can use thyroid medication too, depending on the cause. But usually it's the monitoring is the big one. And then obviously if it's really a big nodule or many nodules, we can either remove the nodule, partially remove the thyroid, or just get the thyroid out of there to treat it. Next we'll talk about thyroid cancer. Mr. Rod Stewart here is a thyroid cancer survivor, and there's many others in Hollywood actually too. So pretty common actually, and the US rates are definitely increasing for thyroid cancer. We're not necessarily sure why, and we'll get to that in a slide or two here. But these are abnormal cells that we see that grow within the thyroid gland, and they mutate and they cause cancer. Some symptoms you may have: you may feel a lump, you may feel some hoarseness or some problem swallowing like before, some neck pain, and with cancer we usually tend to see lymph nodes. Sometimes it can be hard to differentiate if you have a nodule or a lymph node, but that's why you come in and see us in the office. Just a little visual here. You probably wouldn't be able to see this just on the outside, but that's just a nodule within the thyroid gland. Some possible causes of thyroid cancer tends to be in females quite a lot. Rod Stewart obviously was not a female, but there are a lot of females that develop thyroid cancer. A lot of times we see that the patient has been exposed to radiation of some kind. We're not necessarily sure the exact types or if there's a correlation between specific types, but it definitely is a risk factor. And there's also a genetic mutation. You know, if there was a family history, if there was some type of genetic predisposition that can result in thyroid cancer as well. How do we treat thyroid cancer? Surgery is definitely probably the mainstay, either partial or total thyroid removal. Usually the whole thyroid is removed. We can use thyroid medication afterwards. When you don't have a thyroid, you need to replace the thyroid levels. You can use a radioactive iodine therapy, and that's usually in a pill form. And then just general cancer therapies. We can use external radiation, we can use chemotherapy, and then other cancer destroying drugs. So this is just a summary slide. It's a little bit blurry, so I apologize for that. But on your left, we see the hypo, or the slow symptoms of thyroid disease, and on the right, we see the hyper, or out of control thyroid symptoms. So just kind of a good comparison slide just for you to just kind of have on hand. So I have a little joke here, or a little meme for thyroids that I thought I'd share with you. It says, I wake up every day planning to be productive, then my thyroid says, ha, that's a good one, and we laugh, and then I take a nap. Typical thyroid. And that concludes our presentation, and look, my son is in the PowerPoint. I couldn't let Caitlin take all.
Yeah, we had to keep it fair.
All the spotlight on that one. So, if anyone has any questions, feel free, and we're happy to answer you as best we can.
You were first.
I had last year through an exam for an ear exam. It had to be an eye, ear, nose, throat specialist.
Yep.
Done with the ear, and he said, "Do you have trouble swallowing?" And I, why? You know, he was doing my ear. He said I had a mass on my thyroid. It was a 4.6 centimeter. I had a very normal thyroid. There was no problem. Since I had that half out, it was a small mass over here, but they only took half the thyroid. I've had what I think are, and I'll find that out through an endoscopy, esophageal spasms. Are they related to thyroid surgery? Does it disturb? I mean, they go in with what, a chainsaw?
Exactly. Anytime you have surgery to your neck, it's possible they could have irritated a nerve in that area. So it is possible. I can't say that with certainty that that's what caused it, but it's definitely very possible because the nerves that run through there control your esophagus as well. So it's definitely possible. Oh, sorry.
So give her the mic.
I don't think we can go that far.
Can we stretch?
Just repeat her question. Or you could say it.
Yeah, we don't think we can stretch. She had a question. She had a 4.6 centimeter? That's a big one. Nodule on her thyroid, and she had part of her thyroid removed along with the nodule. And after this time, she's having what she believes to be esophageal spasms, which is like a tightening up or spasming of the esophagus, and it hurts, she says. She's wondering if this could be related to her surgery. And that's when we said, yes, it's possible. I mean, the nerves run in the same area, but it could be unrelated because people do get esophageal spasms for other reasons as well. So I'm not going to make any promises one way or the other, but it's definitely possible.
Yep, definitely possible.
Well, as a physician assistant, when you order all the tests, but if you find something, the doctor that's overseeing you, is that the one that does the surgery, or you don't do surgery, do you?
Well, we both.
Oh, and repeat the question.
Oh,
we wanted to
sorry. So she's asking, so as PAs, if we diagnose a thyroid problem in the clinic, are we able to do surgery to remove it or to do more of a procedural treatment? Technically, if we were trained to do that, we could. We just work in the clinic, so we don't do any surgeries. PAs can only first assist in surgery, so they could never do a surgery by themselves. In her case, or in any case, usually we would be referring you to an endocrinologist, and they would kind of take the case on from there. So usually it's through a specialist.
So we could treat, like if it was just hypothyroidism, we could treat you with the pills, things like that. But if you needed surgery, then we would refer you. But if it was just getting your thyroid levels back under control, we can do that, no problem.
Yep.
And oh man, way in the back.
I was diagnosed with a thyroid issue about 10 years ago, and I've been on levothyroxine since then. What are the side effects that could happen to me? I've been on it for all these years.
Really, it's the side effects are only if you're, oh, repeat the question. Okay. So she's been on levothyroxine for about 10 years, and she's wondering what are the potential side effects. Really, the only side effects would be if we are over or under treating you. And those would be the same side effects as being hyper or hypothyroid. Being on the actual medication itself is just like your body producing those natural hormones. So the problem would be if you're not on the correct dose, you might become symptomatic. Does that?
Do I have to worry about having it removed?
Typically, if your thyroid punks out on you and it's not working, it's less likely at that point to get like an overproduction, like an enlarged thyroid, but it's still possible that you could grow a nodule or something like that. So you should still have it checked yearly, like on exam, like just have it palpated. Yeah.
Okay. Yes. Blonde.
You talked about when you drink coffee, you need more medicine. So are there any foods or anything that can help reduce? I have hypothyroidism. So they told me I'm going to be on the medicine the rest of my life. I got the max dose.
Oh, geez.
Okay.
You have to take 25% more. Are there other things that can help reduce that level of medicine that I have to take by eating different things or?
Well, I can offer a little bit of guidance. The question was, she is hypothyroid and she's on the highest dose of levothyroxine that's available or that's safe to take. And she's wondering what other things maybe can be done on her own or with help to either reduce that dose or to prevent it from being abnormal and not needing a higher dose. I mean, I would just recommend just healthy lifestyle habits. I mean, healthy eating, so like whole grains, fresh fruits and vegetables, low-fat dairy, lean protein, lots of water, daily exercise, and that's like 30 to 60 minutes of cardiovascular exercise a day, in addition to weight training and stretching, like all those kind of things. Just generally taking care of yourself, I think, would be the best thing.
I also heard that fluoride in your water is really bad for your thyroid.
The fluoride's been getting a bad name for just about everything lately. I would say that we haven't had any like scientific journals really prove if fluoride's as scary as a lot of people are coming out with. So the answer to that we could probably give you in like 2 years if we're going to quote anything that's really been peer reviewed and things like that. I do know like fiber you might need an increase of your medication with like a really high fiber diet. I just read that today. I was like, somebody's gonna ask this question. So the high fiber, they said if you're taking like a fiber supplement, like a FiberCon, something like that, they don't think it affects it as much as an actual high fiber diet, which is really a healthy diet. So that's kind of a bummer. But fluoride, I'm gonna plead the fifth on that one. Can't prove anything right now, so I'm not sure.
Anyone else? Okay. How about you first?
When you go and have your lab work done and they say your TSH levels are okay, should they also be telling you, is there a like for your T3 and your T4, or?
I think the question is, when she has her thyroid levels taken, does she just need the TSH, or do we need to go further with T3 and T4? I mean, most doctors, I feel like, just do a TSH just to start off. Personally, I like to do a TSH and a T4.
And I agree with that.
Just to be a little more complete. And then I mean, I will also have patients who want, TSH, T4, T3, TPO, like lots of tests right off the bat, and which can be helpful, but initially it's not necessary to do that right away. But I like the TSH and the T4 because those are inversely related, so then you can make a little bit more of an assessment.
I 100% agree.
I think she is.
Can I have another question?
Yeah.
Yes.
When you were talking about treatment of hypothyroidism, you said to take the Synthroid with food. Mine says an hour.
Before you eat.
Okay.
In the morning before breakfast. Yep, before, yes. I probably was nervous, maybe said with, before
I've been
breakfast.
doing it an hour and I thought.
Yep, no, you were
you're good.
correct.
You're good.
Before breakfast.
Yeah, way in the back. Okay, so the question was, I think it was very similar to what we just answered. What is the best time to take your thyroid medicine, and what foods should you not or should take close to taking the medicine? So the medicine should be taken on an empty stomach at least an hour before you eat. I guess I'm not really sure exactly on certain foods. I don't know if you can help me out with that one, but
Calcium.
yes. I mean, to a point.
That is true. And then along with the caffeine too, usually you drink your coffee in the morning. I mean, as long as you're taking the same amount of coffee every day, you're not going to need like a different amount of thyroid hormone. And your body's pretty good at, if you're a little off one day, it regulates. But if you typically take your pill, an hour later you have your bagel and your coffee, and then you give that up, you might notice a change in your dosing.
Yes, so the question was, are there any medication you shouldn't take along with or that would interact with thyroid medicine, like levothyroxine? The answer is yes. I don't know if I can give you a list of them.
Long.
There's a lot. But generally, I feel like levothyroxine is a very safe medicine. It's safe to take during pregnancy. Usually, we want your thyroid to be regulated, so it's something that you need to have on board, and it usually doesn't have too major of interactions, but there's always drug interactions with medicine. There's always something. So, pardon me?
Top 5. That's really putting us on the spot.
I know.
Calcium supplements, a lot of things that are packaged with calcium. So if like you're a Tums girl, like anything that's like, with the calcium, PPIs like omeprazole, Prilosec, those sort of things can sometimes mess with the absorption as well. So those are my top 2, but I'd be lying if I had like a 3, 4, and 5 all evened out.
Yes, we can get back to you. We just need to look it up.
Soy is one, so you have to avoid soy.
Soy. There you go. Learn something every day, guys.
Okay.
These are more things that we tell you. Go ask your pharmacist, and they'll tell you. This is how we get out of some of those questions.
Yeah. But yes, right here.
Would you talk a little bit about the parathyroid glands, why we have them, and what the purpose is, and so about that? And do we have an endocrinologist here in Rapids?
Parathyroid gland regulates like the calcium in your body. That's pretty much one of its only jobs. You can survive without your parathyroid glands. We can take them out and you'd still function properly. We just would watch those calcium levels. And endocrinologists, we do have some that come to Rapids from Wausau, a few of them actually. So I guess technically, yes, we do have endocrinologists in Rapids.
But no one who is stationed right in town.
But they come a few times a week to Rapids.
Mm-hmm. And just to add to the parathyroid glands, they're just accessory organs or glands, so they kind of help the thyroid regulate its hormones as well.
Yes.
You did a good job.
Calcium was going in my blood instead of my bones, and so they removed the parathyroid gland, but there was no change.
Oh. It's possible that, there's 4 of them, so it's possible maybe that just wasn't enough. Otherwise, are you getting mainly your calcium through like dietary or through supplements?
Just what I eat and drink.
Okay.
I take milk, and I don't take supplements.
Well, you're doing everything right, because sometimes if you do the supplements, it does just go to our blood and not to our bones, as well as if we're getting it dietary calcium. But it sounds like you're already doing that.
Okay, thank you.
Mm-hmm. Yes. Yeah, thank you.
Of course, when we were kids, we would go to school and we would get a goiter pill. I don't know.
This is a little before our time.
Sorry, we're not too familiar with it. We're youngins.
Sorry, I
Can you
couldn't.
repeat that?
Yeah, I couldn't hear you.
Because salt was not iodized. That's true. But you know, sea salt is iodized.
It is not. I'm pretty
I don't
sure.
believe so.
I'm pretty sure it's not. I would say if you're really trying to watch your salt and you're doing the sea salt and the healthy things, sadly in America there's added salt in just about everything.
Yeah.
So unless you're like
You don't have to worry.
only eating out of your garden and nothing else, you're probably getting enough.
Yes, way in the back.
If you have a shift in your weight, gain or lose lunch, should you be retested for your level of thyroid? Does that mix up your thyroid at all?
The question is, should you have your thyroid retested after you gain or lose a lot of weight? I guess it kind of depends, was the weight loss intentional or not? If you're really, if you lost weight really rapidly, and even though maybe you were doing healthy habits, and that might be a reason to retest it. If you're, really trying to lose weight and it's really hard for you to, it might be a reason to. I don't know if it's something routinely we do, but it might not be a bad idea.
Anything else, ladies? You talked about the cancer.
So she's asking, are the levels of thyroid cancer or just disease? Okay, just thyroid problems. Are they increasing in the U.S. or is it all over? Is that what you're asking? Okay. I think we're getting better at diagnosing it. I think a couple generations ago, we just kind of used to say, oh, I'm tired, and I just, things aren't just going well. And I think now we have more of a need to know things and to diagnose things and to have a cause for everything. So I think maybe we're just a little more aware of our symptoms, and we Google everything, and I think we have more awareness of things that are going on. So maybe that's why, and the United States is the best country in the world, so we have the best tests and we have the best everything. Sorry for those of you who aren't from the U.S. So I think it's just better awareness and better technology.
Anybody else? Well, that wasn't so bad. All right.
All right. Ooh, we did good.
And we were afraid that this was only gonna take like 20 minutes because once I started talking. But it was like right on time.
I think we're all done then.
Thank you for coming.
Thanks.